Environ Life Science Limited, partnering for life.
Hello friends, I am Dr. Anshuman Manaswi and I am a senior plastic surgeon at La Transformation Plastic Surgery Center, Mumbai, and I am attached to Nanavati Hospital, Bombay Hospital and Apollo Hospital. Today we are going to discuss a very sensitive topic, which is gender reassignment surgery, or commonly called as sex change surgery. Before we discuss about these surgeries, we have to discuss about some more important points which are related to who are these patients who want to undergo these surgeries. This is a very important point and we must pay a lot of attention to it. In the normal spectrum of human beings, there are people who are of one sexuality, either they are male or they are female. Then on the other spectrum, there are people who consider themselves trapped in a different body. They feel as if their soul is trapped in a different body. This means that if they are a female, they think they ought to have been born as a male, and if they are a male, they think that they should have been born as a female. This creates a huge psychological disturbance in their mind right from childhood, and they feel very disturbed and anxious. And the correction of these patients by these surgeries helps them immensely, and they feel that they have got liberated. But there is a caveat. The caveat is that these surgeries are permanent, and before we undertake this journey, we have to be very sure that we belong to that category of gender identity disorder, gender dysphoria, or transgenders. In the whole spectrum of humans, there is a community called LGBTQ, and in that LGBTQ, this is one extreme wherein we find these people who are not able to adjust at all. So there are certain guidelines which have been created by the government to identify such patients. So first thing is, in case you are suffering or your family member is suffering from this kind of a problem where they are not able to identify your child or your sibling, first thing is to reassure them that there are solutions to this. How you will understand, how will you find out whether they have these problems is they tend to identify themselves with the other gender. So they would mix around with the other gender much more, get attracted towards their same gender, and they like to privately dress as the other gender. These are certain things, and behavioral wise also they feel they would be more like the other sex in their normal lives. Once these features are there, the first thing is to see psychologist or a psychiatrist who would undertake certain tests. We ideally recommend 2 independent psychiatrists so that there are hardly any chance of any wrong diagnosis. Because one wrong diagnosis can spoil one life and make the doctor also feel very guilty about it. So we want to minimize the chances of error. So never push it hard. Once the diagnosis is made, then the choice is how to go about it. There are 2 specialists who are important in this. One is a plastic surgeon and another specialist is an endocrinologist. Endocrinologists manipulate the hormones so as to give you that kind of a internal environment where your new body or your new identified sex will be dealt with, and the plastic surgeon actually carries out the surgery. Now let us come to the surgery per se. When we talk about male to female gender reassignment surgery, which are much more frequent, then it involves 2 major surgeries. One is breast augmentation or a feminine breast, which is a simple surgery relatively, in which we put a silicone implant or a fat to give that augmented breasts. The hormones also help a lot in this. The second part is the lower down surgery, which will actually give you the right to call yourself a woman, and that is replacing the external genitalia of the male to a female. That means removal of the testis and the penis, and reconstruction of the vagina and the other structures of the external genitalia of female, like labia majora, minora, clitoris, etc. All these can be made, and quite successfully, and functionally also the patient or the person will do good in the long term. The second surgery is a little complex surgeries, takes around 4-5 hours, and the recovery period is around 3 to 4 weeks. One can resume normal activities and sexual activities after a couple of months. Obviously, there are certain complications which may happen. Some may be trivial, some may be a little serious. So it is important for you to discuss in detail with the plastic surgeon about the pros and cons of these surgeries. The lower surgery of creation of vagina involves basically using the intestine, which is large intestine, the colon, or the inverted penis skin, which is preserved to give it a shape of a vagina. Both these surgeries have got their own pluses and minuses, and they must be discussed with the doctor in a very open fashion. The most frequently carried out surgery and the most safer one is penile inversion technique, penile skin inversion technique, and which gives a good result with utmost safety. After these are the facial feminizing surgeries are done, in which the hair remodeling is done, the facial remodeling of high cheekbones, thin jawline, or more feminine nose is taken care of. Then the voice change surgery, wherein the male voice pattern is replaced by a high pitched female pattern of voice, and then the Adam's apple reduction. So there are multiple things in which can be undertaken, and these may involve a series of surgery. Never push very hard, because a lot of things done at the same time may just create problems and may sometimes do irreversible damage. So be cautious, be patient. It is a journey which you have undertaken, and you must not hurry it up. Coming to female to male gender reassignment surgery, this is a much more complex task, and the first part of this surgery is removal of the breast, removal of the uterus, removal of the ovaries and the vagina. After these surgeries are done, then comes the next part, which is the reconstruction of the penis, which is a very complex surgery not done by many people in the country or in the world, wherein which we create a new penis with other part of your body. It is reconstructed using microvascular surgery, and the recovery time in this is also around a month. These surgeries are big surgeries, and there are chances of certain complications happening. Please discuss it with your doctors, understand the pros and cons of it. And after the penis is reconstructed, then we have to put a silicone implant to harden the penis, and then the testicular implants to give it a shape of the testis and the scrotum. Then beard transplant also can be done, and mustache transplant to give it a full male appearance. A lot of our patients have undergone these surgeries and have got married as well. So it is a very satisfying experience for the doctor as well as for the patient. One other important thing, which for male to female section surgery, is the laser hair reduction, which is again gives a lot of satisfaction. The last part which I want to discuss about these surgeries is that this is a journey which is quite tough. You have to be emotionally strong, and you have to have a support system. But sometimes if the parents do not agree, you can convince them. So all the best. In case of any query, you can write to us at latransformation@gmail.com, and please do write to us or comment. Thank you so much.